Would you like free audiobooks? Click the link in the description. Question 1. A 22-year-old male patient presents to the emergency department with a 24-hour history of abdominal pain, initially located in the periumbilical area and now localized to the right lower quadrant. Which of the following assessments is most important for the nurse to perform next? A. Palpate the abdomen for rebound tenderness. B. Obtain a complete blood count, CBC. C. Ask the patient to rate the pain on a scale of 1 to 10. D. Check for the presence of Rovsing's sign. Correct answer. D. Check for the presence of Rovsing's sign. Rationale: Rovsing's sign, pain in the right lower quadrant upon palpation of the left lower quadrant, is indicative of appendicitis. This specific assessment helps differentiate appendicitis from other abdominal disorders. While A, B, and C are valuable assessments, identifying specific signs of appendicitis like Rovsing's sign is crucial for early diagnosis and management. Question 2. A patient diagnosed with appendicitis is scheduled for surgery. Which of the following nursing interventions should be prioritized preoperatively? A. Encourage deep breathing exercises. B. Apply a heating pad to the abdomen. C. Maintain the patient in a supine position. D. Withhold oral intake. Correct answer. D. Withhold oral intake. Rationale: withholding oral intake is essential to prevent aspiration and reduce the risk of complications during anesthesia. Deep breathing exercises are beneficial postoperatively for lung expansion. Applying a heating pad may worsen inflammation or cause rupture, and positioning should ensure comfort and reduce tension on the abdominal area, not necessarily supine. Question 3. After an appendectomy, a patient reports nausea and the inability to pass gas. The nurse recognizes these symptoms as indicative of A. Normal postoperative recovery. B. Intestinal obstruction. C. Surgical site infection. D. Inadequate pain control. Correct answer. B. Intestinal obstruction. Rationale: nausea and the inability to pass gas can indicate an intestinal obstruction, a complication post-appendectomy. While nausea and changes in bowel movements can be part of the normal recovery process, the inability to pass gas particularly suggests a blockage. Continuous monitoring and intervention are necessary to prevent further complications. Question 4. Which laboratory finding is most likely to be elevated in a patient with acute appendicitis? A. Hemoglobin. B. White blood cells, WBC. C. Platelets. D. Serum amylase. Correct answer. B. White blood cells, WBC. Rationale: an elevated WBC count is common in acute appendicitis due to the body's inflammatory response to the infection. Hemoglobin, platelets, and serum amylase might not be directly affected by appendicitis and are not as indicative of the condition as the WBC count. Question 5. A patient with suspected appendicitis reports increased pain when the right thigh is extended. The nurse understands this sign as A. Obturator sign. B. Murphy's sign. C. Psoas sign. D. Bloomberg sign. Correct answer. C. Psoas sign. Rationale: the psoas sign is positive when pain is elicited by extending the right thigh, indicating irritation of the psoas muscle by an inflamed appendix. The obturator sign is associated with rotation of the hip, Murphy's sign with acute cholecystitis, and Bloomberg's sign, rebound tenderness, with peritoneal irritation. Question 6. The nurse is providing discharge instructions to a patient who has undergone an appendectomy. Which of the following statements by the patient indicates a need for further teaching? A. I should report any signs of infection around the incision site. B. I can resume heavy lifting within a week after surgery. C. It's important to follow up with my healthcare provider as scheduled. D. I should gradually increase my activity level as tolerated. Correct answer. B. I can resume heavy lifting within a week after surgery. Rationale: patients are advised to avoid heavy lifting for several weeks post-appendectomy to prevent strain on the surgical site and reduce the risk of hernia development. The other options indicate appropriate understanding of postoperative care. Question 7. During the assessment of a patient with suspected appendicitis, the nurse applies pressure to the lower left quadrant and then quickly releases it, observing the patient's reaction. This assessment technique is known as A. Rovsing sign. B. Obturator test. C. Psoas stretch test. D. Bloomberg sign, rebound tenderness. Correct answer. D. Bloomberg sign, rebound tenderness. Rationale: Bloomberg sign, or rebound tenderness, involves applying and then quickly releasing pressure in the lower left quadrant to assess for pain in the right lower quadrant, indicative of peritoneal irritation, commonly seen in appendicitis. This technique helps in diagnosing appendicitis by highlighting peritoneal irritation. Question 8. A 16-year-old female patient reports sudden onset of right lower quadrant pain, nausea, and vomiting. Upon examination, the nurse notes a low-grade fever and tachycardia. The patient's mother asks why these symptoms are occurring. The nurse's best response is A. These symptoms are typical of gastritis, which is inflammation of the stomach lining. B. Your daughter is showing signs of appendicitis, which is an inflammation of the appendix, likely due to blockage. C. This could be a case of pelvic inflammatory disease, which is common in teenage girls. D. The symptoms suggest kidney stones, which can cause severe pain and gastrointestinal symptoms. Correct answer. B. Your daughter is showing signs of appendicitis, which is an inflammation of the appendix, likely due to blockage. Rationale: the presented symptoms are classic for appendicitis, including right lower quadrant pain, nausea, vomiting, low-grade fever, and tachycardia. Appendicitis often results from obstruction of the appendix, leading to inflammation. The other conditions mentioned have different symptom profiles and likely causes. Question 9. After an appendectomy, the nurse should prioritize monitoring for which of the following complications? A. Pulmonary embolism. B. Acute pancreatitis. C. Paralytic ileus. D. Myocardial infarction. Correct answer. C. Paralytic ileus. Rationale: paralytic ileus, a temporary cessation of bowel peristalsis, is a common postoperative complication, especially after abdominal surgery like an appendectomy. Monitoring for signs of gastrointestinal motility and function is crucial. The other options, while serious, are not the most common or directly related complications of appendectomy. Question 10. A patient with a history of appendicitis reports sharp, persistent right lower quadrant pain that worsens with movement. The nurse understands this symptom could indicate A. Resolution of appendicitis. B. Rupture of the appendix. C. Beginning stages of appendicitis. D. Postoperative healing. Correct answer. B. Rupture of the appendix. Rationale: sharp, persistent pain in the right lower quadrant that worsens with movement, especially in the context of known appendicitis, is alarming for a possible rupture of the appendix, leading to peritonitis. This condition requires immediate medical attention. The other options do not accurately represent the seriousness of the situation indicated by the symptoms. Question 11. When educating a patient scheduled for an elective laparoscopic appendectomy about the procedure, which of the following points should the nurse emphasize? A. You will be placed on a mechanical ventilator for a few days post-surgery. B. You should expect to remain in the hospital for at least a week following surgery. C. It's common to experience some shoulder pain due to the gas used during the procedure. D. Most patients require a large abdominal incision for this surgery. Correct answer. C. It's common to experience some shoulder pain due to the gas used during the procedure. Rationale: laparoscopic appendectomy often involves the insufflation of carbon dioxide gas to create space for visualization and instrument manipulation. The residual gas can irritate the diaphragm, leading to referred pain in the shoulder postoperatively. The other statements are incorrect. Mechanical ventilation is not typically required post-laparoscopy, hospital stays are generally short unless complications arise, and a large incision is not necessary for laparoscopic procedures. Question 12. A patient presents to the emergency department with right lower quadrant pain, nausea, and a fever of 38.5 degrees Celsius 101.3 degrees Fahrenheit. The nurse knows that which of the following diagnostic tests is most commonly used to confirm appendicitis. A. Abdominal X-ray. B. CT scan of the abdomen. C. MRI of the abdomen. D. Ultrasound of the abdomen. Correct answer. B. CT scan of the abdomen. Rationale: CT scans are highly effective in diagnosing appendicitis because they can provide detailed images of the appendix and surrounding structures, helping to identify signs of inflammation, blockage, or rupture. While ultrasounds can be used, especially in children and pregnant women, and MRIs provide excellent soft tissue contrast, CT scans remain the gold standard for diagnosing appendicitis in many clinical settings. Question 13. The nurse is assessing a patient who is postoperative day 1 following an appendectomy. The patient complains of pain at the surgical site, rated 7 on a scale of 0 to 10, and is reluctant to ambulate. Which of the following nursing interventions is most appropriate? A. Encourage the patient to remain in bed to rest and recover. B. Administer prescribed analgesics and encourage gradual ambulation. C. Advise the patient that pain is normal and to try ambulating without pain medication. D. Immediately inform the surgical team to reassess the surgical site. Correct answer: B. Administer prescribed analgesics and encourage gradual ambulation. Rationale: postoperative pain management and early ambulation are key components of recovery to prevent complications such as deep vein thrombosis, DVT, and pulmonary embolism, PE. Administering prescribed analgesics can help manage pain, making it more comfortable for the patient to ambulate. While reassessment by the surgical team is important for worsening or unusual symptoms, pain and reluctance to ambulate on the first postoperative day are not uncommon and can be initially managed with nursing interventions. Question 14. During a health education session about appendicitis, a patient asks how to prevent this condition. The best response by the nurse is: A. Regularly taking antibiotics can prevent infection of the appendix. B. Maintaining a high-fiber diet may help prevent blockage of the appendix. C. Frequent medical checkups can prevent appendicitis from developing. D. Appendicitis cannot be prevented, but early treatment can prevent complications. Correct answer: D. Appendicitis cannot be prevented, but early treatment can prevent complications. Rationale: currently, there is no known method to prevent appendicitis. The condition often results from a blockage in the lining of the appendix, leading to infection. While maintaining a high-fiber diet is generally good for digestive health, it does not specifically prevent appendicitis. The focus should be on recognizing symptoms early and seeking prompt medical treatment to avoid complications like rupture. Question 15. A nurse is providing discharge instructions to a patient who underwent an appendectomy. Which of the following signs and symptoms should the nurse instruct the patient to report immediately? A. Mild incisional pain. B. Bruising around the incision site. C. redness, swelling, and drainage from the incision site. D. Nausea without vomiting. Correct answer. C. Redness, swelling, and drainage from the incision site. Rationale: redness, swelling, and drainage from the incision site could indicate an infection, which requires prompt medical attention. While mild incisional pain, some bruising, and nausea without vomiting can be normal postoperative experiences, the presence of infection signs needs to be addressed to prevent further complications. Question 16. The nurse is preparing a presentation on appendicitis for a community health fair. Which of the following points should be included to describe the classic symptoms of appendicitis? A. Left lower quadrant pain, constipation, and fever. B. Right upper quadrant pain, jaundice, and dark urine. C. Right lower quadrant pain, nausea/vomiting, and fever. D. Periumbilical pain, shifting to the right lower quadrant, and dysuria. Correct answer. C. Right lower quadrant pain, nausea/vomiting, and fever. Rationale: the classic symptoms of appendicitis include right lower quadrant pain, often starting around the navel and then moving, nausea/vomiting, and fever. These symptoms help differentiate appendicitis from other abdominal conditions. While dysuria is not a classic symptom of appendicitis, it can occur if the inflamed appendix is near the bladder. Question 17. A patient with appendicitis is experiencing severe abdominal pain and guarding. The nurse understands that guarding is a sign of A. Decreased peristaltic movement. B. Severe constipation. C. Peritoneal irritation. D. Intestinal obstruction. Correct answer. C. Peritoneal irritation. Rationale: guarding, a reflex contraction of the abdominal muscles, occurs in response to acute inflammation or irritation of the peritoneum, as seen in appendicitis. This protective mechanism aims to minimize movement and reduce pain caused by pressure on the sensitive inflamed tissues. Question 18. For a patient with a suspected appendicitis, which of the following nursing actions is most appropriate while awaiting diagnostic confirmation? A. Encourage the patient to drink clear fluids to prevent dehydration. B. Apply a warm compress to the abdomen to relieve discomfort. C. Position the patient on their left side with their right knee flexed. D. Administer a laxative to relieve any constipation. Correct answer. C. Position the patient on their left side with their right knee flexed. Rationale: positioning the patient on their left side with the right knee flexed can help alleviate pain by decreasing tension on the abdominal muscles and the inflamed appendix. Encouraging fluids orally or applying heat may worsen symptoms or mask the signs of a ruptured appendix. Laxatives should be avoided as they can increase the risk of appendix rupture. Question 19. A 30-year-old patient presents with symptoms of appendicitis. The nurse knows that this condition is least likely to be confused with which of the following diagnoses in this age group? A. Gastroenteritis. B. Ectopic pregnancy. C. Mesenteric lymphadenitis. D. Cholecystitis. Correct answer. B. Ectopic pregnancy. Rationale: ectopic pregnancy is a condition that should be considered in women of childbearing age presenting with abdominal pain, but it is less likely to be confused with appendicitis in a patient where pregnancy is not applicable, for example, a male patient or a woman not of childbearing potential. Appendicitis shares overlapping symptoms with gastroenteritis, mesenteric lymphadenitis, and cholecystitis, making these conditions more commonly considered differential diagnoses. Question 20. In teaching nursing students about appendicitis, the nurse educator emphasizes the importance of recognizing the shift of pain from the periumbilical area to the right lower quadrant because it indicates A. The onset of peritonitis. B. Migration of the inflammatory process. C. the appendix has ruptured. D. The patient is likely to require immediate surgery. Correct answer. B. Migration of the inflammatory process. Rationale: the migration of pain from the periumbilical area to the right lower quadrant, known as McBurney's point, is a classic sign of appendicitis. It indicates the progression of the inflammatory process from the initial, more generalized abdominal irritation to more localized irritation as the appendix becomes increasingly inflamed. This symptom helps differentiate appendicitis from other causes of abdominal pain. Question 21. A nurse is caring for a patient with appendicitis who has just undergone an appendectomy. The patient is now reporting a sudden onset of dyspnea, chest pain, and a sense of anxiety. The nurse's immediate action should be to A. Encourage the patient to perform deep breathing exercises. B. Administer an anxiolytic as prescribed. C. Assess vital signs and oxygen saturation, and notify the physician. D. Position the patient in a high Fowler's position. Correct answer. C. Assess vital signs and oxygen saturation, and notify the physician. Rationale: the sudden onset of dyspnea, chest pain, and anxiety postoperatively may indicate a pulmonary embolism or other serious cardiopulmonary issues, requiring immediate assessment and intervention. Assessing vital signs and oxygen saturation provides crucial information on the patient's respiratory and circulatory status, and notifying the physician is essential for rapid response and treatment. Question 22. During a postoperative visit, a patient who had an appendectomy reports experiencing sharp, localized pain in the right lower quadrant during certain movements. The nurse recognizes this as possibly indicative of A. Normal postoperative healing. B. The development of an abscess. C. Gastrointestinal perforation. D. Incisional hernia. Correct answer. B. The development of an abscess. Rationale: sharp, localized pain in the right lower quadrant that develops postoperatively, especially when associated with specific movements, may indicate the formation of an abscess. While some pain can be expected during the healing process, localized sharp pain warrants further investigation to rule out complications like abscess formation, which requires prompt treatment. Question 23. A nursing student is learning about the pathophysiology of appendicitis. The student understands that the initial event leading to appendicitis is often A. Bacterial infection within the lumen of the appendix. B. Blockage of the appendix by fecalith. C. Perforation of the appendix. D. Inflammation of the gastrointestinal tract spreading to the appendix. Correct answer. B. Blockage of the appendix by fecalith. Rationale: the initial event leading to appendicitis is often the blockage of the appendiceal lumen, commonly by a fecalith, a hardened piece of stool. This blockage disrupts the normal drainage and leads to increased intraluminal pressure, bacterial overgrowth, and eventually inflammation and infection of the appendix wall. Question 24. Which of the following dietary recommendations is most appropriate for a patient recovering from appendicitis surgery? A. Strictly adhere to a liquid diet for the first week post-surgery. B. Gradually reintroduce high-fiber foods to prevent constipation. C. Focus on high-fat foods to replenish lost nutrients. D. Consume small, frequent meals of spicy foods to stimulate appetite. Correct answer. B. Gradually reintroduce high-fiber foods to prevent constipation. Rationale: postoperatively, it is important to prevent constipation, which can strain the surgical site and cause discomfort or complications. Gradually reintroducing high-fiber foods helps maintain bowel regularity. A liquid diet may be recommended initially, but it's not sustained for a week. High-fat and spicy foods can be difficult to digest and may not be suitable in the early recovery period. Question 25. A patient with suspected appendicitis is found to have an elevated serum C-reactive protein, CRP, level. The nurse interprets this finding as indicative of A. Dehydration. B. Acute inflammation. C. Bacterial infection. D. Chronic disease process. Correct answer. B. Acute inflammation. Rationale: an elevated serum C-reactive protein, CRP, level is a nonspecific marker that can indicate acute inflammation in the body, which is consistent with appendicitis. While CRP levels can also rise with bacterial infections and some chronic diseases, in the context of suspected appendicitis, it most directly suggests an acute inflammatory process. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.